today's anti-inflammatory drugs. We're going to discuss the inflammation process that can occur in osteoarthritis and compare and contrast to anti-inflammatory medications that are used to treat this condition. First, let's talk a little bit about anti-inflammatories. It is a drug class that consists of many medications that most of us have taken at one point or another. It includes some of the medication that is over the counter, such as aspirin, ibuprofen, naproxen. There's prescription NSAIDs, which is Celebrex, ketoprofen, oxyprofen. NSAIDs are non-steroidal anti-inflammatory drugs, and they work by inhibiting the production of prostaglandin, which is synthesized in greater amounts at the site of injury and play a significant role in the inflammation process. Other medications that are anti-inflammatory are corticosteroids, and we're talking about the injectable form. So that's triamcinolone and methylprednisolone acetate. Osteoarthritis and inflammation. Osteoarthritis is a common and progressive disease that primarily affects synovial joints, and more likely the ones that are weight-bearing. Synovial joints have an area between the bones which consists of synovial fluid that lubricates the ends of the bones. And there's cartilage around that smooths and cushions the bones as they hinge with each other. Osteoarthritis involves destruction of cartilage, bony growth developments on the ends of the bones, inflammation and pain, as you can imagine, and impaired motion. Inflammation is a natural protective response to an acute injury. And when healing's occurred, the inflammation normally subsides. With chronic conditions such as osteoarthritis, that inflammation remains. Treatment options range from diet and exercise, physical therapy, orthotic devices or assistive devices like canes, medications, some of which we are talking about today, and surgical procedures such as arthroplasty and fusion. As far as lifestyle contributing, joints are prone to injury, wear and tear. Inflammation, impingement, or tear can happen with sports and other injuries or overuse. As we compare the two medications, the NSAID, which we're using Celebrex, and the inarticular corticosteroids, which could be the triamcinolone or the methylprednisolone acetate, we can look at the mode of action. With Celebrex, that medication inhibits the COX-2 enzyme, which aids, the COX-2 enzyme aids in the production of prostaglandin, which is part of the inflammation process. With the corticosteroids, it provides anti-inflammatory and immunosuppressive results by interrupting the cascade effect. Vascular permeability is decreased and prevents the development and release of prostaglandins and leukotrienes, which are inflammatory mediators. As far as efficacy, Celebrex is similar to the efficacy from other NSAIDs. With the corticosteroids, usually there's pain relief within 7 to 10 days after the injection, and that pain relief can last 4 to 8 weeks. As far as safety, Celebrex is metabolized exclusively in the liver and should not be used if the patient has severe hepatic or renal disease. And if the patient is taking aspirin, as the daily aspirin to prevent for cardiac prevention, they should not take Celebrex because that could cause stomach ulcers, etc. Because it is an NSAID, and aspirin is an NSAID. With the corticosteroids, systemic effects can be found with frequent use. So it's recommended that the patient not have an injection any sooner than 3 months after the previous one. They can also have quite a bit of pain at the injection site. As far as expected outcomes with the Celebrex, the expected outcomes would be, as with most of the NSAIDs, relief of the inflammation, the pain, and the signs and symptoms of the osteoarthritis. With the corticosteroids, you could have pain relief with just one injection, but you may need additional injections. Again, no earlier than 3 months apart. And in one, as I was doing the research, I read one comment that said that they usually don't give more than 3 injections in a lifetime, but they did not explain why, and I could not find that information elsewhere. So that is a mystery. Thank you for watching this presentation.